There is a very long history of trying to reform the American healthcare system. Some people think it goes back as far as the first Congress, 1790. Congress at that time passed a law requiring ship owners to buy insurance for their seamen to cover advice and treatment by a doctor. There was a loophole in that bill. Didn't cover hospitalization in case the seaman was really sick. So Congress came back in 1798 and passed a law requiring that seamen have hospital insurance. After those two bills, not much happened on American health insurance. Modern health insurance really dates itself from 1883 and Germany. The Chancellor of Germany, Otto von Bismarck, an aristocrat and very conservative individual, actually led the campaign for universal health care coverage. That's a big surprise. He was worried about the growth of socialists, the growth of communists, and the fact that workers' allegiance was being shifted over to the Socialist Party. So to counter that, he developed a comprehensive social insurance program that included pensions, unemployment insurance, and compulsory health insurance through independent, non-state payers called sickness funds related to employers. That program was funded by payroll deductions from employers and employees. The Bismarck Plan was adopted by a number of countries in Europe in the next few years. The first modern advocacy for universal health care coverage in the United States occurred in the 1912 presidential election. That election pitted Wilson against Taft against Roosevelt. And Teddy Roosevelt, running as a progressive, advocated for national health insurance plan. His plan, interestingly, was supported by the AMA. With his defeat, the AMA teamed up with the AALL, the American Association of Labor Legislation, to begin developing a universal health care coverage bill. But those entire ideas actually never went anywhere for two reasons. First, we entered World War I, and anything related to Germany became tainted and could not be enacted. Second, and probably more surprisingly, American labor opposed universal health care coverage. Samuel Gompers, president of the AFL, thought he could get a better deal by negotiating with employers for his coverage, and he was opposed to the government providing health insurance and taking the loyalty of workers away from the union. Well, after World War I, not much happened until the Depression. Franklin Roosevelt was sworn into office in 1933. He quickly created the Committee on Economic Security, CES, and charged them with looking into what programs should be developed for workers. They looked at pension programs and Social Security. They looked at unemployment insurance, and they were debating health insurance. There was a big disagreement on CES over the political feasibility of a national health insurance program, in large measure because by this time, the AMA was staunchly against any national health insurance program. In the end, the Committee on Economic Security did not recommend to Roosevelt to include health insurance in the Social Security bill, and Social Security was passed without health insurance in it. President Roosevelt frequently talked in private about the need to have comprehensive health insurance in the country, but he never did much in public. In 1943, in the midst of World War II, Senators Wagner and Murray and Representative John Dingell introduced a comprehensive compulsory health insurance legislation that was to be administered through Social Security and financed by a 1.5% payroll tax on both employers and employees. That bill did not go far. 3 months after the end of World War II, President Truman sent a special message to Congress about the need for compulsory national health insurance legislation. He proposed that it be under Social Security and to cover medical, hospital, nursing, laboratory, and dental care. It was an integral part of his Fair Deal program. Even though Congress was controlled by Democrats, the Congress did not take up his bill and didn't consider it seriously. Might surprise you, but President Truman was pretty unpopular in 1948, and not many people gave him a big chance of winning re-election. In fact, it was a very complicated race, and there was a third party running to the left of Harry Truman, Henry Wallace. As part of his program, Harry Truman advocated for compulsory national health insurance to keep liberals to vote for him instead of for Henry Wallace. He campaigned vigorously on the compulsory national health insurance program. He wasn't expected to win, and many of you will remember that famous Chicago Tribune headline, "Dewey beats Truman," which of course was false. When he won, many people thought compulsory national health insurance would become law of the land. The AMA went into a panic. It assessed each of its members $25 for a war chest to fight against Truman's new plan. The AMA hired a public relations firm called Whitaker and Baxter in California to hone a campaign against Truman's plan. They came up with the idea of not wanting a bureaucrat between you and your doctor, of Truman's plan being socialist medicine, and they, in the end, along with the rise of communism and the Cold War, defeated any chance that universal health care coverage would become part of Truman's fair deal. All during this time, Republicans were not quiet about health care reform. It might surprise you that a young congressman from California named Richard Nixon, soon after he came into Congress, introduced a bill for health insurance to be funded by the federal government. And then in 1950, he co-sponsored a bill with the Representative Jacob Javits from New York called the National Health Care Act. In that bill, the Republicans proposed that individuals should buy private insurance, that they should be given a subsidy by the federal government linked to their income. So the poorer you are, the higher your subsidy to buy private insurance. And the one thing is, it didn't have a mandate. It was a voluntary program. That's how things stood in the 1950s. A long series of healthcare reform ideas, some of them compulsory, some of them voluntary, many of them through private insurance, some of them through the government. Going forward, health insurance was a big national debate, but not much happened. Next, we're going to consider the modern era of health insurance reform in the United States, the enactment of Medicare and Medicaid, and then the attempts to create a more universal system. And we'll see how frustrating it is every time for people to try to get a universal health care reform bill passed.